Welcome. This is one of the initial interviews that we're doing with residents and patients and consumers of the health service as a way to relay the experiences of some of our community members to the health services that we provide. And so today we've got Erin Brown with us, who has been a patient of the health service and her family. So I'll introduce Erin, and Erin will give a bit of an overview about her experiences and how they interface with the health services and what they were. So Erin, I'll ask you if you can give a bit of an overview about the services you've received from East Grampians Health Service, then we'll go through a few more questions. And thanks for availing your time, and you're aware that it's part of what we're trying to do to improve our services. So thanks, Erin, for your time.
So we had nearly everyone in our family had COVID over the start of January and the end of January. And every second day after reporting the positives, we were getting phone calls just to check up on how everyone was going and asking what extra support we needed. If we had access to someone to do shopping and stuff for us, it was really good.
Yep. How many people in your family that were affected or infected with COVID?
So we've got 6 children,
Yep.
and all except 2 children have had it so far. So hopefully the last 2 also don't get it.
Yeah. So you had extended lockdowns as family members tested positive at different times, is that correct?
Yeah, so my husband tested positive first on a Thursday, and then my daughter tested positive on the Friday, and then on the day 6 test, another child tested positive, so that started the whole lot again. And then there was a break of about 2 weeks, and then I caught it, and then one of the other kids caught it a couple of days after my positive, and then my daughter caught it as well.
And what age are your children, Erin?
17, 15, 13, 6, 3 and 2.
Yeah,
so the 17 and 13-year-old haven't had it yet. Yeah.
And across your family, and were you infected as well?
Yes, I had it as well. I was really sick.
You were sick?
Yeah, really sick. It was horrible.
Yeah, what were some of the symptoms you had?
My whole body hurt. My head was like, it felt like everything was moving underwater.
Yeah.
Just really unwell. Temperatures, shaking. It was horrible.
Yeah. And so how long did that go for?
I think it was day 3 and 4 were the worst.
Yeah.
And after that it sort of went away again. I'm just really tired still.
Yeah. And how frequently were the phone calls to you, particularly when you were feeling unwell?
Every second day. Yeah, we were getting them every second day.
Yeah.
Till the end of our 7-day lockdown.
Yeah.
Yeah.
And was that enough? Did you feel well enough supported when you were feeling unwell?
Yeah, definitely. Yeah, it was good.
And did you have a number to call in case you got increasingly unwell?
Yes,
because we know that
the hospital, when I spoke to Kate, she gave me the numbers to call if anyone got worse, and advised, if they get really bad, to call an ambulance.
Yeah.
So it was really good, really helpful.
Good. And that would have been a challenging time for you to have the children then feeling unwell. Did you have to avail the health services shopping or support?
No, we were lucky enough when the original lockdown, when we all had to stay home, we had my husband's family doing a lot of shopping for us. And then, Sam, my husband, did all the running around when we were sick. Me and the last kid was sick.
Yep. Is there anything we could have done differently at the health service to improve that service to make you more comfortable with the care or the treatment or anything?
No, I really don't think there is. I thought it was really good, helpful, and not overwhelming as well, like not every day, and because that would have been stressful.
Yes. And how did you access the services? Because you received phone calls from the health service and support from the Healthy at Home team.
Yeah.
How did you get referred, or how did they know that your family had?
I'm not really sure. We just reported the positive tests, and then I assume it goes onto a database and they get notified of the people in the area.
Yeah.
We didn't have to make contact with anyone. They made first contact.
Yeah. And did you have any visits from the East Grampians Health Service team? Did anyone come to your home?
No, I did get a package dropped off with a oxygen finger thing to monitor when the kids were originally sick, and an information pack with all the services available.
Yeah. And with that oxygen pack, did you use that then, report that in the phone calls? Or how?
We didn't need to use it, so I think Sam took a phone call from somebody and they asked if he'd been using it, but he hadn't.
Yeah. Are there any suggestions for the team that we could do anything differently or?
No, I really don't think there is. Like, it was really good.
Great.
Yeah, I was really happy with it.
Well, hopefully you're through the worst of it now and the other two children don't get infected or test positive, and then you can get back to normal living, and I see you're back to work today, so.
Back to work, yes.
Oh,
Yeah, it'll be good.
Oh, great, thanks Erin, and this is part of our process, is to get feedback from community members who can speak directly to the video system, so if there's issues that people do have with the care, they can speak frankly, and then we can report that and get a direct line to board directors so they can hear about our care and services. But thanks for coming in today, Erin, and I know it's your first day back at work, and thanks for your time, and hopefully all goes well and you can get back to work and your children can continue on what they're doing. Thanks Erin, thanks for your time.